There's a lice outbreak. Will I catch it? Do I have to shave their head? How do we get rid of it? Is it already in the house? The kids are going back to school, and so are these little critters called pediculosis capitis, better known as head lice. We're going to dive into Head Lice 101, covering prevention, identification, and treatment. I'm your host, Meg Conover, physician associate, and let's get started. If you find this content helpful, please subscribe, share the video, or watch another one. The kids are going back to school and they're going to be sharing lots of germs and bugs. If you find this video helpful, check out another one like pink eye or symptoms of strep throat. First things first, let's understand what head lice are. Head lice are tiny, wingless insects that live on the human scalp and feed on the blood. They are most commonly found among children but can affect anyone. The lifespan of the female louse is about 1 month, during which she lays 7 to 10 eggs per day, cementing them firmly to the base of a host hair. The eggs, commonly called nits, are oval capsules that hatch in 8 days. They release nymphs that require another 8 days to mature. After hatching, egg cases become white and more visible. Adult head lice are grayish white, 2 to 3 millimeters in length, with mouth parts that suck blood and legs adapted to grasping hairs. Adults feed on both the scalp and adjacent areas of the face, neck, and behind the ear. Adult lice can survive up to 55 hours without a host. Head lice are typically spread through direct head-to-head contact, like laying down next to someone who has lice for 30 minutes. They can be transferred from brushes, combs, and hats, but the risk is pretty low and currently debatable. Lice do not jump, fly, or even travel on pets to get to humans. The contribution of brushes and hats to the spread of lice is controversial. A study performed in an experimental setting suggested that the use of hair dryers, combs, or towels could lead to louse transmission. However, other studies investigating the prevalence of lice on bedding and floors after exposure to an infested person have not supported these routes as modes of transfer or spread. How do you know if your child has lice? Look out for signs such as persistent itching, red bumps on the scalp, redness, and scratching behind the ears, and of course, the presence of lice or tiny nits attached to the shaft of hairs. Remember, itching might not start immediately after infestation. Itching occurs as an allergic reaction to lice saliva that is injected during feeding. In a child who's never had lice, the onset of itching may be delayed until sensitization occurs after 4 to 6 weeks. Rarely, secondary staph infection occurs, and you might see enlarged lymph nodes of the neck. The best way to deal with head lice is to prevent them in the first place. And keep their hair tied back to minimize head-to-head contact. Encourage them not to have head-to-head contact while they're at school, maybe during reading time. If your child does get head lice, don't panic. There are several treatment options available and they're very effective. You can find over-the-counter shampoos, creams, or lotions specifically designed to kill the lice. Types of treatment include creams and manual combing, also known as wet combing, and even oral medications, but those are only used for resistant cases. Regardless of the treatment selected, the presence of living lice should be confirmed prior to treatment. Patients with nits but no detectable nymphs or adult lice likely do not have infection. If nits are only found more than 6.5 millimeters from the scalp, these patients do not require treatment. Clinician approaches to these patients vary. Some will treat and some won't. There's always a possibility of missing live lice during examination as well. Okay, here's the at-home hack you've all been waiting for. Cetaphil, also called the Nuvo method, created in 2004 by a Stanford-trained dermatologist, Dr. Dale Perlman. Apply the Cetaphil cleanser through the scalp to dry hair. After all the hair is wet, wait 2 minutes for the Cetaphil to soak in. Comb out as much excess cleanser as possible. Blow dry your child's hair. It has to be thoroughly dry down to the scalp to suffocate the lice. Expect this to take 3 times longer than normal drying. The dried Cetaphil will smother the lice. Leave it on your child's hair for at least 8 hours. Wash off the Cetaphil with a regular shampoo. To cure your child of lice, repeat this process twice in 1 and 2 weeks. The cure rate can be 97%. Other examples of effective topical treatments include pyrethroids, pyrethrins like permethrin, malathion, spinosad, and topical ivermectin. Yes, you heard it. topical, or vermectin. These should all be rinsed off with water after the recommended time. Do this over a sink instead of a shower or bath to limit skin exposure. Rinsing with warm water is preferred over hot water to minimize systemic absorption of these medications. Hair should not be washed with shampoo for 24 to 48 hours after treatment. Louse survival off the scalp beyond 45 to 55 hours is unlikely. It's reasonable to recommend washing hair care items, clothing, and linen used by the infested person during the 2 days prior to therapy in hot water and drying the items on high heat. Temperatures should reach at least 130 degrees Fahrenheit. Items that can't be washed may be dry cleaned or stored in a sealed plastic bag for 2 weeks. Vacuuming the furniture and carpeting on which the person has sat or laid down has been suggested. Of note, the risk of transmission from these sites is low. Spraying the home with a pediculicide or a pesticide that kills lice is not recommended. Head lice transfer to pillowcases at night, but the incidence is very low. Pillowcases pose a risk for reinfection with head lice, but the risk is low. Changing the pillowcase is a reasonably and cost-effective strategy to minimize this risk. Lice on pillowcases can be killed by heating the pillowcase by immersion in water greater than 60 degrees Celsius or hot wash 15 minutes in a clothes dryer. Household members should be examined and treated if live lice or nits within 1 centimeter of the scalp are seen. People that share beds with infected individuals should be treated prophylactically, even if you don't see any live lice on them. Head lice in school can be a concern, but don't worry, it's manageable and likely not as bad as you think. Children should not be excluded from school based upon the presence of live lice or nits. Lice are often present for weeks prior to detection. Furthermore, the majority of children with nits do not develop active infestation. Affected children should avoid direct head contact with other children and should be treated promptly with a topical pediculicide or wet combing session. A study from Queensland, Australia showed 2,200 plus children examined from 118 classrooms. 466 had head lice. A total of 14,000 lice were collected from these children, an average of 30 lice per infected child. No lice were recovered from the classroom floors, leaving the conclusion that classroom floors are not a risk in transmission of head lice, and no special anti-louse measures are required. Now let's clear up some myths about head lice. Contrary to popular belief, lice are not a sign of poor hygiene, and they don't jump or fly. They crawl from one head to another in close contact situations, head-to-head contact for extended time. Well, that wraps up our Head Lice 101 video. Remember, head lice are common, and it's essential to take proactive measures for prevention, early identification, and effective treatment. Stay informed, and you can tackle head lice like a pro. If you found this video helpful, don't forget to give it a thumbs up, leave a comment, and subscribe. Remember, I have other videos covering common childhood school-related illnesses. Check them out on my channel. Until then, see you next time.